Navigating your health care can be confusing and often overwhelming, but St. Francis Hospital is streamlining the process to make it easier than ever before. At the brand new Comprehensive Women's Health Center at St. Francis, women can receive coordinated health care across a range of specialties, from mammograms and gynecology checkups to acupuncture and heart health. Here to now explain further is Kathy Noone, the Executive Director of the St. Francis and Mount Sinai Regional Cancer Center. Kathy, thank you for being here on Connecticut Style. So explain to me how the Comprehensive Women's Healthcare Center is kind of changing healthcare for women.
What we're trying to do is make sure that women can stop by, come on by for whether it's to have their screening mammography done on an annual basis, if they need to see a primary care physician for their internal medicine needs, or coordinated services in order to have one place. Women tend to put ourselves last. So we're really trying to promote the self-care, prevention, and wellness so that we can prevent some illnesses from further developing down the road.
So kind of like one-stop shopping, right?
Absolutely.
Do you think this is the wave of the future when it comes to healthcare?
I really do, because what we're finding is the fact that people will more likely take care of themselves if we make it simpler. If we streamline healthcare, if it's one place that they can go for all of their services needs, they're more likely to take advantage of those services.
And what has the patient response been like?
Absolutely phenomenal.
Well, they like this, then,
They
right?
really, really do. Is that the fact that they're coming in, they're not spending one appointment in one location, having to come back for yet another location for a different appointment. They're there, it's coordinated, it's seamless, it's absolutely phenomenal.
And how does this affect the doctors?
Doctors love it because the fact that they're able to connect with each other. If they're talking about the common patient, then they're able to share information, develop a treatment strategy or prevention strategy right there on the spot.
So not only are you kind of redefining the healthcare here, you're also providing services for patients that can't afford care. Talk to me about the Patient Assistance Fund.
What we're trying to do is all of our cancer patients at some point, usually upon graduation, when they're a survivor, or when they're going through treatment, usually want to give back. And what we have at St. Francis is donated funds, and we have a foundation where families or patients can donate money to, and we in turn then use those dollars in order to identify patients that might be needing to bridge a gap in between the time that they're seeing a provider and perhaps when we can plug in financial services, such as, how difficult is it to, battle cancer when your lights are about ready to get turned off?
I'm sure very difficult, right?
Really, really hard. So the fact that our families and our patients are giving back and allowing us to kind of bridge a gap until we can have a complete plan in place for that patient is wonderful.
Can the general public help with this fund?
Absolutely. They can call our foundation, and that's 860-714-4900, and the foundation would positively hook them up in terms of how they can give back and assist us in those endeavors.
So Kathy, this is part of our Pink Power show today. You have your pink on. I'm wearing my pink. We have to mention how we're offering free mammograms for
in keeping with our mission and our philosophy about prevention and wellness, and early detection saves lives. We all know that. We've talked about that. We're offering 2 coordinated events with Radiology Associates of Hartford, one in Glastonbury, one in Hartford, on October 29th, where women can register to come in and have free mammography services coordinated that day, have a surgeon available, and be able to take advantage of some of our high-tech solutions.
And who's eligible for that? Is it just about anyone?
Anybody. Some people are in between insurance. Perhaps
Sure.
they've just recently lost their job. They haven't been able to register for one of the exchanges. We're available.
Very good. Kathy Noone, thank you so much for being here.
Thank you for having us.